Hi, this is not my cutest look. This is not a fashion statement. I didn't have any intention of doing a video or being seen today. But I had a procedure very early this morning and I was a little bit nervous, had some reservations for my particular situation, and I couldn't really find anything out there. I went to YouTube, I went to Google, and I saw a lot of things on the actual procedure, but not answering the questions I had, and I wanted to know. So I don't know who, but I think that this will be helpful to some of you out there. So this morning I had Mohs surgery on my scalp because I had some skin cancer up there. It's my third round with skin cancer. I had melanoma like in my late 30s and a squamous cell around then to now I've had a basal cell cancer on my head. And so for my melanoma, I had a surgical procedure. They cut, it was in my lower back, they cut very deep and kind of a large scar to get that out. And then for my squamous cell, I did some chemotherapy cream and that took care of it. And for my basal cell now, I did a Mohs surgery. And something that I was concerned about is that since it's obviously front and center and I don't have a ton of hair anyway, are they going to have to shave my head? Are they going to have to dig so deep that they dig out my hair roots and I have a permanent bald spot? I had lots of questions. So the basal cell, I noticed it probably, this is July 22nd, and I noticed it probably in December, and it looked like there was a pimple on my scalp, not in my part line over to the side, but I've never had a pimple in my scalp before, and so I thought it was probably just a clogged hair follicle. And it looked like a pimple, but I would say that the whitehead part, this is probably going to be gross, but I feel like it's a good public service announcement for someone that this is going to affect and you don't even know it's going to affect you. And so I think it's important because usually the people that you expect and think in your head who are going to get skin cancer is like an 80-year-old bald man. And my skin cancer surgeons last week, he had a 16-year-old in there who had a melanoma removed off of her leg. Even though it generally happens in older people, he said that his average patient is in their 60s. It still does happen to young people, and you don't know if you're going to be one of those people until it hits. The only thing different about it from a pimple, it looks like a pimple, but the whitehead part, I would say, was probably the bulk of what I know now was a tumor. Whereas with a pimple, you know, it's mostly the red part and then you'll have a little whitehead. I would say that most of it was this whitehead area. The skin over the whitehead was thicker and sturdier. It wasn't thick. It still did look very much like a pimple, but it was thicker and I feel like a little tall for a whitehead. So I thought it was a clogged hair follicle, and I did something that scares me to death now to think about. I took a safety pin and I sterilized it and I put it in there to release it thinking, okay, this is gonna unclog it and make it go away. Don't do that. It was the wrong thing to do. I just didn't know what else to do. I had no thought in my head that it could be cancer, that it was any big deal whatsoever. So after I did that, it flattened. The whitehead went away, it flattened down. I thought it was getting better, but then within a few days, within a week, it was back to where it was. So I visited the dermatologist in January. I go every 6 months for a checkup. She didn't really think it was much of anything. She gave me some medicine. And so I applied this and it would look like it was getting better, but then it would come back up. So I had another appointment in May and I mentioned it to her again. It wasn't that big a deal in my mind. I kind of just thought about it as she was checking my scalp. It wasn't anything that I'm like, oh, I need to go talk to her about this. I didn't think that much of it because it didn't look like that big of a deal. It looked like a really normal type of thing. And so she's like, well, let me go ahead and just remove it. That way you'll be done with it and you won't even have to mess with it. So she scooped it out with her scalpel and I didn't think another thing of it. This didn't look scary. It didn't look like a mole at all. And the fact that she had saw it and didn't think anything of it, that gave me complete reassurance that it didn't look like anything scary. So I literally walked out of that office and never gave it another thought until I got a call a week or so later. And they called me and said that it was cancer, that it was a skin cancer tumor, basal cell carcinoma. That can be a scary thing. My parents didn't end up getting skin cancer. Other relatives that are definitely older than I am haven't had skin cancer. And some people can go to tanning beds and tan their whole life, and you just don't know who's going to get skin cancer. Obviously, some people are going to have a genetic predisposition to it, a breakdown in their DNA, some type of mutation that allows this to happen and to recur. And you don't know who that person is until it hits. I take tons of care in the sun. I am so very careful. Anyone can become a victim to skin cancer. My husband works with radiation machines that treat cancer patients, and one of the doctors there used to actually work with a zoo, and she had treated wolves who have super thick hair for skin cancer. Not necessarily the most tan people or the people who've had the most exposure. It certainly can be, but even if you're not, even if you have dark skin, that doesn't mean you're safe. And there is a myth with basal cell that melanoma can kill you, but that basal cell can disfigure you, but it won't kill you. But that's not true. If you let it go too long, each of these skin cancers, including basal cell, can kill you if you do nothing. So for my Mohs surgery, they scoop out layers and put it under the microscope, and they keep going until they have completely clear margins, until they see no more tumor, unless it is to a point that they can't get at all. I was concerned that they would have to shave my hair in that area, and they did, but they tried to keep it minimal, and I don't have tons of hair anyway. It ended up being about the thickness of one of my bangs, which isn't much, again, if you have a lot of hair, but if you don't have tons of hair, it's kind of startling, and no one wants a bald spot on front and center of their head, particularly women. And I was really concerned that they would dig so deep that they would dig out my hair roots and leave me with a permanent quarter-sized bald spot. Even though I can do wigs or hair toppers, I didn't want to have to. And so in my case, they were even able to pull the skin together on my scalp. They had to use staples. I have 7 staples in my head, and they pulled that together so that the empty spot, the scarring, will be as minimal as possible. Now, if the area is too big, they had thought that they may have to do a skin graft from my neck and put it up there, but luckily it was small enough that they were able to staple it. If you have too large of an area, in other words, if you've let it go too long, then you could be in the situation where you have the bald spot. Luckily, I'm super duper careful about checking my skin. So we caught this early. My dermatologist, when she scooped it out, didn't quite get all of the cancer. It looked like it. We thought she did. And it even healed really well. It had a slightly discolored scar. It looked like the color and size of a pencil eraser, a little lighter. And it was there. It was flat. It looked great. It looked like a scar that had healed wonderfully. I thought that she got it all. So if I were a person who wasn't as careful, who was not good about following through at the doctor, who didn't want to spend the money or couldn't afford to spend the money to have the Mohs surgery, and if I was unwilling to pay that, there was cancer left behind, and that cancer would have eventually spread, be life-threatening and even fatal. Even though it's just skin cancer, it can kill you if you don't take care of it. Some more quickly than others, but all of them can be fatal if you do nothing. So if you go in and your dermatologist takes something off and tells you that it's some kind of cancer and should recommend that you go in for some sort of procedure or check to make sure they got it all, make sure you go for that follow-up procedure, because it may look fine, but there can still be cancer left. So with the staples, they're kind of nice, because with the sutures, I wouldn't have been able to wash my hair. With the sutures, I have to wash my hair every day for the next week. You can also get basal cell, or any skin cancer for that matter, on your face. So if you see a pimple on your face and you assume that it's just a pimple, if it doesn't go away in a few weeks or certainly a month, then that is something concerning to ask your doctor about, because skin cancer can be very disfiguring. It can go deeper, it can go wider, and that just makes a wider and deeper area that they will have to scoop out of that area. Could be your face. So the quicker you catch it, not only is it better for your longevity and your health, but also aesthetic wise, they're not going to have to do as much damage to the surrounding skin to try to get it all. There is a risk of recurrence if you've had skin cancer before. Good chance of getting any of the types of skin cancer again. Probably not in this area since he had clear margins, but it is something to watch out for. You may be like me, the first and only one in your family to have skin cancer issues. You may think it's nothing at all. You don't know until it starts happening. So protect your skin, keep an eye on it, get your skin checks. If you have a problem, make sure you get a follow-up. Whether you have a shaved head for a few months or whether you have a permanent bald spot, it's worth it to get it taken care of to save your life. Okay, this is 24 hours later. Well, I just got out of the shower. I have no makeup on, and I want to give you a trigger warning, because 24 hours after the Mohs surgery, if you've had staples, which I believe the reason they put staples in my head is because there's movement, there's not much tissue there, and so it doesn't hold together as easily as maybe your arm would or something. So there's not a lot of skin to work with. And so I have staples in my head. 24 hours later, you were supposed to remove the bandages and either wash your hair or clean the wound. So I've cleaned out the blood. There was various parts of tissue in my hair still, and I'm going to give you a trigger warning because there are 7 staples in my head, and it doesn't look bad. I think it looks great. The shaving of the hair is so super minimal. When you see it, when I was seeing them pull it out, I was really scared, but I think they did a good job. And with me being a woman, I know that they were extra careful. They kept it as minimal as possible. There was shaving that they did before they did the extraction. They only had to do 1 extraction with me because he was able to get all of the cancer and have clean margins with that first round. And then they did a little more shaving when they went to do the staples. As far as aftercare, I need to clean it, wash it with water and soap every single day. And I returned to the surgeon in 2 weeks to get the staples removed, put Vaseline on it to kind of protect it. And they said it would help with the wound healing and scarring. You have to take it easy for 48 hours after the surgery, especially with head wounds in particular. Your head has so many little capillaries and blood vessels. And since there isn't a lot of skin here that the staples are pulling together, they don't want it to pull the wound open or to get it bleeding. I'm not supposed to work out for a week. I'm not supposed to swim. You can have acetaminophen for pain. Can't take ibuprofen because that thins your blood and they don't want to encourage the bleeding. It does hurt and it aches. And when I laugh or cough or make expressions or bend down, a lot of things hurt, and it hurts all of the time, but it's not horrific or anything. I took 1 acetaminophen last night after the pain meds had well worn off, and the pain was uncomfortable. It wasn't terrible by any means, but it was uncomfortable. So I'm going to show you the wound just so you can see what it looks like. And again, this is a trigger warning. It looks fabulous. It looks so much better than I thought it would look, but staples may be disturbing to you. There is not much blood, but you can see the wound. So I'm going to remove this just to show you what it looks like. I thought I would be able to wear hats with this, but something about it, just like when you pull the hat down and it just being there rubs and pulls at the wound, so I'm not going to really be able to do that. I'm going to wear scarves for the next couple weeks until I get the staples out. So I think it's going to heal great. I think you probably will be able to see the scar when it's all said and done, but I think it's going to be minimal and not nearly as bad as I thought. So I wish this video was out there for me. Hopefully it helps answer some questions for you. I hope you'll never need this. I hope no one you know ever needs this, but if someone is struggling and wondering and has all of these questions, I hope it's helpful to you, and good luck.